We're talking with Dean Knatzer, and Dean, welcome to the Dr. Bob Show.
Thank you.
Tell me about your shoulder. When did you first start having shoulder problems?
I guess when I was in college, probably throwing frisbee, playing sports.
Were you a good frisbee thrower?
I was.
Yeah, and you had a dog that would catch your frisbee?
I did. I had a Weimaraner that was a frisbee expert. He could catch them hanging out in the air if I could throw it long enough, but I think he was one of the best frisbee dogs I'd ever seen.
When you would hurt your shoulder, would it get better and then you'd hurt it again?
Yep, over for 20, 30 years I would injure it and then it would get better, and then eventually I would hurt it again, and I went through this cycle many times, you know, trying to lift weights or whatever. I would eventually hurt it. And
so how bad did it get before you decided, I got to get it fixed?
when I couldn't pick up my arm above and turn the volume on my radio and put it in gear and stuff, I knew I had to do something, and I'd been that way for several months after throwing a cast net and hurting it down on the lake fishing.
Would it hurt you more at nighttime? Did you have difficulty sleeping?
It did bother me at night, particularly hard to sleep. I'd wake up at night, my whole arm would be numb.
When you went to see Dr. Brady and he said, let's fix it, and he fixed it, how was the recovery? How long did it take you before you were ready to rumble?
I did very well, probably within 3 months. I felt pretty good.
Did you work real hard on it with physical
I did.
therapy?
The therapy, I was above and beyond. If they said do 10, I'd do 15, and I did it at least twice a day at home, you know, plus I went to the therapy center, you know, a couple times a week, but I was pretty religious about it.
And Dr. Brady told me he saw you on the lake recently and he was watching you cast and your shoulder was perfect. How's your other shoulder?
My good shoulder is now my bad shoulder.
So the bad shoulder is now, how good is it?
It's, I would say, close to 100%, you know, as far as I can tell, you know, where this one I'd say it's maybe 80.
So the one that hasn't been fixed yet is now your bad shoulder.
Yeah.
It used to be your good. What would be your advice to people that was having shoulder pain and they couldn't move their shoulder and they couldn't sleep at night time?
Go see a good doctor and get an MRI, and then they can tell for sure. I wished I'd have done it probably 15 years ago. Would have made life a lot easier for me.
Dean Knatzer, it's so nice of you to come to the Dr. Bob Show. You're a great friend of mine and a great fisherman, and it's nice to see you where you've got a good shoulder and you can do what you want.
Well, thank you very much.